Today, we're diving into the world of Anne-Marie is a leadership coach, educator, and transformation strategist who believes it's time for a new way of leading, especially in health systems. Her work centers on embracing complexity, fostering collaboration, and creating space for clarity, courage, and purpose. With over 2 decades of cross-sector experience in the public, private, and not-for-profit worlds, Anne-Marie helps individuals and organizations navigate uncertainty, untangle complexity, and co-create more regenerative ways of working without burning out or losing sight of what matters most. Her approach blends systems thinking, change leadership, and deep human connection. She's trained in change management, holds a black belt in lean healthcare, and is certified in systems coaching, ORSC, and flow-based leadership. Anne-Marie also teaches at the Telfer School of Management and recently took the TEDx stage to share her insights on systemic leadership. Whether she's coaching gifted professionals, designing culture-shifting programs, or facilitating multi-stakeholder collaborations, Anne-Marie is known for meeting people where they are and helping them lead with integrity, clarity, and flow.
Yalla, Anne-Marie.
Hi, Anas.
It's my pleasure to having you. As I told you, you mean to me a lot having you here today. Especially you have a lot of experience in the system and especially in the Canadian system. And we would like to hear from you, your perspective and how you see the Canadian system. And down the road, we will touch base some of the critical area. And I know you are specialized here. So I thought to discuss the Canadian system and the broken system. So I have two choices, either to bring the the minister, or bring you. So I thought to bring you. So please let me know, or let my audience know who you are.
Yeah, no, absolutely. And maybe unlike a lot of guests that you'll have on your podcast, I don't have a clinical background, but that does not mean that what I bring to the table can't be useful. And maybe to give you a bit of my background, I used to work in management consulting. And what I really enjoyed was bringing large groups together to solve complex problems. And out of all the sectors we were working in, I noticed the amount of complexity in the healthcare system. And it was like, that's the sector I want to focus the rest of my career in. The complexity of the problems, kind of the systems issues that needed to be addressed. And I just thought, it was like, I have all these skills, let's go into healthcare and bring them there. And I thought these skills would be welcome. But as I was learning about the culture of the healthcare system, it was quite challenging to, one, understand all the intricacies in the health system, but also show the value of maybe trying to do things differently.
So do you see yourself, you are welcomed in the system or not?
Well, it depends. I think they're starting to get more openness, but like 12, 15 years ago, my expertise or background would have been in change management. And when I transitioned to healthcare, my first role was helping with the implementation of an electronic health record, for example. And as the project was progressing and things were going well, there wasn't necessarily anybody assigned to do change management specifically on this project. And this was quite some time ago. And I was like, well, wait, there should be somebody doing specifically change management on here. Can I help with that? And they said, well, yeah, sure. But as long as you do your other role. And I was surprised that in healthcare, embracing change management was like, well, yeah, sure. But I mean, really, it was just interesting. There was this great physician champion who was actually the one who brought the idea on board of bringing this electronic health record, like ahead of other hospitals. And he had read in a medical journal this cool idea about what another hospital did about introducing electronic health records. And actually, they were on a really bad system, and they were going to transition to a new system that was much better. So they had this great activity to get people excited about the new system and the new features. And so this physician says, we need to do something like this here. And so I read the paper, but I noticed the context was different. They were already electronic and going to a better electronic system. So it made sense to have an activity to create excitement around it. But our hospital was going from paper to electronic.
A huge change.
It's a huge change. And people could not yet envision what the future would be like. And so asking them, what are you excited about? Was like, well, I don't know what I'm excited about. Like, I don't even know what it means to work with a computer. How is my workflow going to look like? How am I going to know how to use the system? So I was kind of advising, saying, well, we shouldn't do this activity. It's going to, we should do something else to help them understand how things are changing first and then get them excited. But because I was a physician and my recommendation based on my expertise was kind of decline it. Well, we'll try it out anyways. And I thought that was interesting. I was like, well, this is my expertise or my understanding of human systems. And I was like, okay, this sector is different. There's a hierarchy in terms of knowledge or aspects, but there wasn't that much openness then to, I guess, other skills, depending on. So that was kind of my introduction to healthcare.
I think there is hierarchy for the power, not for the knowledge.
Yeah.
Because everyone, we agree that the knowledge is exchangeable and we want to learn. But the power, we don't want to exchange the power. We need to keep the power with us. One thing here for your intro, you are the first one in my guest. You are non-clinical. And this is here. I bring you by intention to give that insight. There is a lot of the people where they see the system from different lenses and they have a good story and they can support us and we can work together. And that's
absolutely
not necessarily sometime like change management or sometime to see the strategic level need to be care from clinical background. For sure, you need the experience, but this experience it's achievable as long as you are in the right place. But that not necessarily to start with this. And I thought I am sure you are the right one to be here and discuss this with you. And I want to assure you, still the change management is suck everywhere till now. Nothing changed. So I can assure you with this. And still we are in the chapter 1 when it's coming for the change management. They thought it is embedded. If we bring something new, they will adapt. There's no resistance. And all of the user will be from the innovation model. They will be early adapter. So the majority will accept it, what is not the case. And the science is not telling us this is the way how it's worked. But let's see how it will go. So I will ask you a very simple question. Why the system is broken?
That's not a simple question. So this is from my perspective, right? And I'm sure many of your guests will have different types of answers. And I don't claim to be an expert, but I have different knowledge, experiences, education that just make me look at the issues from a different perspective. I do like complexity science a lot and systems thinking. So maybe what I'll do is I'll try to answer your question from that lens.
Yeah, feel free. Yeah.
And I think you likely discussed this or will discuss this with the other guests. But one of the things is I find the health system very siloed. We created these walls between the various parts of the system. And for example, like hospitals are separate from primary care, right? And sometimes there's some connections, but it hasn't been designed to create those connections, for example. And maybe if you want to go a bit bigger, what really saddens me is when you see provinces who are either saying, wait, we need to break out all these regional health authorities and we'll group them into a single health organization, right? Or wait, this is too big. We're going to split this up in multiple separate organizations. And if you look at the trends across the country in Canada, it keeps changing to separating or combining. And I just find that none of those solutions seem to address the issues. And what I say is, in a system, there are parts, but there are connections between those parts. And we focus too much on the structure and not enough on the connections between those parts. And I think that would be one of the things when we're looking at a system is how strong are the connections between all the parts that make the system work. And then what gets tricky is, well, what's a part or what's the system? But what I'm sharing here is the connections or that relationship or, how a patient moves through the system and who's looking at that. So everybody is looking at what is within their box, but they're not necessarily looking at how their box connects with the other box. And in some cases we assume, the ministry is taking care of that, but they're not taking care of that, that they have other policies or priorities or other things to go. So I just find that interesting that there's not enough conversations about the connections.
Yeah, no doubt with that. It's resonated with me. And I will follow this with another simple question. Why? Why they are not connected together and why they are silos?
I don't know. And this would just be kind of like I think it's just easier, right? When you draw a box and you say, well, I work within this box and so I'll manage what's in this box. And I think you might just assume that somebody else is looking at how all the other boxes are connected, but they have different priorities or different aspects that they're looking in the system. And I think if you look at the ministry, I wonder what kind of information are they getting to make their decisions? Who are they consulting? Who are they hearing from? And then the people they're hearing from, what are they trying to advocate for? And they're likely not advocating for connections or things like that. So I think it's part of, you need people to come together to see, well, wait, what are we designing collectively and what are we responsible for? So I think it's in the way that the decision-making structures are done. It doesn't allow for these conversations to happen.
I believe we start to find a pattern when we started to discuss all those issues here through the podcast and out of the podcasts with people like you who are looking to make the change. We started to see there is a necessity for us who are advocating for the patient and the system to be close. It's not necessary to be as a policymaker, but to be very close with the policymaker and the decision maker. Because what is going right now, I can understand it's very complex. It's not easy to connect the country. I can understand. Also, it is a federal government, there is a province government, and it is a regional government. I can understand it is complex. However, it's not excuse, but we can see it. But when it's coming in one single hospital, still we see a silos within the same hospital.
Yep. The same thing happens within a hospital. Absolutely.
Yeah. This is where we need to see it is a red flag, and we need to see it from different perspective. Because I came from different country. I work also in different country. There is a concept where they focus every time on the patient center, and we know that, we say that, we told that. In reality, it's nothing implemented like this. So one of the things I miss here to see it, honestly speaking, patient experience. Patient journey. Those words, in before 4 years, it was on my day-to-day discussion when I was working out of Canada. When I came to Canada, it's rarely to hear that. And it's happened with me for one position. I came from Nova Scotia, and I was in connect with the government of Nova Scotia, and they think about, I don't know how far right now they are into the project, but they are thinking to bring someone out of the government, out from the system, came from private sector, have interact with different solution, with different company, with different market, to come and inject this person, okay, with the system. I will not go further with the details.
Okay.
Still there is a bureaucracy there, but the idea itself, for me, maybe you hear from your position a lot more creative area. For me, this is a creative area since I came to Canada. No one talks about this way. What do you think about when it's coming for the patient center in Canada?
Yeah, I think it's like you said, my sense is there is an intent. I guess we do use the words, and it depends. Some organizations are stronger, I think, with it. They have patient advisory committees and they have more group and they're actively engaged. But in other cases, we might have a committee or meeting and there's only one patient. And that one patient has one story, one experience. And we expect that patient to kind of talk on behalf of all the other patients and all the other stories. So I think when we want to design for a patient-centered system, it really means hearing about multiple different patient stories, not limiting it to one representative. And I'm not saying this to dismiss at all the value of that one representative, but what we need is a diversity of perspective. And that's another concept of systems, is systems thrive based on that diversity of information and perspectives. And when you make decisions and you have multiple perspectives to consider, it'll make that decision better. So I think that's what's missing, is when we think that that one person or that one representative will help us make the system patient-centered. Well, what we need is multiple different patients at the table, their different journeys and their voices. And I do think some organizations are doing this well, but I wonder where the patient voice is represented when we're looking at the broader system as a whole.
They are, or are they presented in Canada, the voice of the patient? Is there any organization advocate on behalf of the patient?
Well, there's multiple, I think, organizations that are trying to advocate and integrate themselves. And this is not necessarily kind of an area that I have necessarily lots of expertise in knowing all of those organizations, but there's a lot of patient advocate groups out there. I think what I'm trying to share is how are we using them? How are we making sure there are multiple voices and that those patients represent a diversity of patient and experiences at the table? One great example that I heard recently, and I thought this was really cool, I had not heard this before. So Diabetes Action Canada when they have a lot of health data about patients with diabetes, and researchers can submit requests to have access to that data to do some research. And the body that decides whether or not the data will be shared with them is apparently half patient representatives. And I think that that is amazing, because then the patients can listen to the research request and go, wait a minute, will that benefit me as a patient who's struggling with diabetes? Like, is this research going to help improve care for patients with diabetes? And I thought that that was a really interesting concept to help tailor research in a way that will actually have a direct impact on patients. So how about having a board with a lot of patient representatives? And for sure, you want to make sure the research is well designed, and has a strong methodology, but that's why the other members on that board, who are looking. But I thought that that was quite innovative in terms of not just having one patient, but a variety
Yeah,
of patients at the table.
you remind me with the healthcare system here in Canada. I'm not sure, but I hear that every single hospital here, they have research center within the hospital. Is this right?
Well, not every hospital, but many hospitals, yes. They have a kind of an associated, or research institute affiliated with them.
Okay. So now my question for you, with all respect for all the efforts it's have been done in Canada, I know this is from your lens. You are not the decision maker across the Canada, but you've been in the market more than me. You work in different hierarchy, and now we will touch base with your current position. I don't know if it is considered government or non-government, but still you see the bigger picture. So you are considered from those who see the bigger picture and try to build the strategy.
Mm-hmm.
So when I see it, Canada investing very well in the health is a huge amount of money.
Yes.
And Canada, they have a lot of incubator centers, a lot of the initiative to promote any new idea and encourage anyone have any idea specifically for the healthcare system, and any entrepreneur they need to support. And there is also, as we discuss right now, research center within the hospital. It's too many. Known as one of the top university across the worldwide was coming for the healthcare. But I'm presenting this from my perspective or from my experience as a normal citizen here. If I compare my experience with the other country where I lived, this is not one country, other country where I lived, they have bad system. But I, as a normal person, realize the improvement which has been given, especially after the pandemic. Here, since I came, I didn't notice any improvement, but I know there's a huge work. Why?
So I don't know if I would say there's been no improvement.
I said I didn't realize as an end
absolutely.
user.
Makes sense. No. Well, I think if you look just from the one thing that the pandemic did do is elevate the importance of health data and making investments in our health data system. And that also includes research, right? Because if you want to do good research, you also need access to good health data. So I think there's been those investments made, and maybe we haven't fully seen kind of the results or the outcome of those, because it is a big country. Data is stored within multiple different organizations, and how do you collect that for the better use? But I think what a lot of people might say is Canada is rich in a lot of health data, but how do we turn that into information or knowledge that is useful? And I've also heard some people argue that it's almost like it becomes a responsibility of the system, if you have access to all that data, to make use of it. It can't just be stored in the database. And again, I think that's part of where are those conversations happening about how do we create a strong health data system to improve patient care, to improve the research aspects of it. So I think it is because of this complex federated system, the different privacy laws across different jurisdictions, what those manage. There's just a lot of complexities. And there are conversations happening. And how do we bring everybody together to agree on, is this our common agenda? Is this what we're striving to work together? And although I think we're all aiming for the same goals and we all want to improve the health system, I have no doubt about intentions. I have no doubt about the intelligence of all the people, but have we spent time clarifying what that common agenda is that we all want to rally? And then do we understand what is my part in contributing to that common agenda? And then how will we measure if that's having any impact or progress? And how is that shared across? So it's a bit of that, like that not coordination role or kind of like a backbone support role that's really missing to create that momentum. So everybody's kind of working on this independently, and sometimes you'll see some good partnerships, but as a system, it's not fully connected.
Who will create this momentum, and who will create this kind of urgency to create that system change and connect it together? Uh, who do you think in Canada? Who are responsible?
I think you need a mix. I think you would need to create, so it can't just be a single organization unless it is part of their mandate. I think if the federal government tried, then that is flawed because of the political aspects of it. So that they would be responsible for delivering of what that elected government wanted for the next few years. And as we know, that can always change. So that would be challenging. And also then the provinces, would they trust what the federal government would want to do, and those tensions and just that relationship there. So I think it's almost, you need to create kind of a new coalition, or maybe not even a new organization, but bring people together who are willing to put their organizational hat at the door and say, what do we need to do together to help fix the system? But I think if it's a single organization that has its own mandate right now, with its defined boundaries and limit, there'll always be limitations to what they're able to do. So I think it is about creating something net new with people who want to create that momentum and that leadership to support such a coalition type setting to happen.
When I remember right now, I think year ago, I connect with you and ask you if there is any tools or any system connects all the healthcare system and all the hospital with the Canada in one platform. And you told me yes, Anas, and you give me that platform. For me, I was working on something as a project. When I opened it, I got lost it. I didn't understand anything. I felt I am very stupid. So I end my let's say assumption how to build my outcome, and then started with something else. So comparing what it's there and that platform, what is doing there, and what we have discussed, we need an organization to mandate and to make that urgency. Right now, with the limited resources, with the limited power, with the limited everything's here, who is the entity or organization try to take care for everything to collect it in one place to help them with the data for the decision maker?
Yeah, well, right now there's the Canadian Institute for Health Information. So that's the organization that I work for now. They collect a variety of information in different sectors, but it's not necessarily complete. But then there's also Canada Health Infoway that they've been working a lot on trying to ensure that there would be more digital health technologies implemented across the country. And CIHI and Canada Health Infoway are working together on different projects to help ensure that there's more interoperability of the data across the system. So it's not even a single organization just there. It's an example of multiple organizations who need to work and cooperate because they have different mandates and support. So I think that would be kind of one example of two organizations, and there's more involved that really need to come together because they all hold a piece of the puzzle and they all have a different role to play in advancing this.
Understood. And makes sense. Is no shame or harm from having different organizations specialized in different mission and mandated. But are those organizations, those three organizations, connect with the other organization, observe them, supervise them to make sure they are connected?
Yeah, and that's what's interesting, because I think any system that would have like a larger, like if that's the federal government, for example, I think that's where you'll see some tensions between, is the federal government overseeing this, but does that link to what the provinces want? So I think that's what makes it complicated. And like, how would you trust that single organization? And so how do you create a system where everybody knows what their part in the system is? And
you try to be politics. It seems no, they are not connected.
but then what I think is that there could be a way to do this that where if there's a lot of transparency in the information, if people are sharing what they're working on, the system can hold itself accountable. And we always think that it only has to be like a top organization in our models of hierarchies or how organizations work. But sometimes you can have an organization that doesn't have that authoritative or kind of like holding people accountable from that way. But what I do believe is if there's shared accountability in the system and people willing to say, hey, wait a minute, you guys were supposed to do this piece, but it's not done. So we can't connect our piece to it. How do we work on this? And then if the other, so that's where creating those space for that accountability within the system to happen. I just think there's some limitations, and I might be naive when it comes to this. But I'm thinking of my own experience when I was working on a small team, for example, right? And one of the best experience of a team that I've worked on was when we were working on implementing that electronic health record. Our project manager was busy dealing with a lot of the politics or other aspects, and our team kind of learned to self-organize amongst each other. And we had our plan. We knew what folks do. We were willing to challenge each other when we had disagreement on ideas. And if somebody hadn't played their part or weren't part on time, we could challenge each other and go, wait a minute, are you doing that and not following up? And we didn't need somebody to tell us what to do or make sure all the pieces were right or going in advance. So I think it is because of experiences like that, that I think that that same experience at that little team level could work across the system if people are willing to play differently and have those conversations and hold each other accountable. But as soon as one organization wants to pull the power, wants to be in control of everything, wants to be known for a certain thing, then that trust and those connections in the system don't work. So what is that glue that connects everybody in the system to want to work on improving the system together? And how do we create space to have the conversations? Because right now, I think what's happening is people have different perspectives of the problem, different perspectives of how to solve it. And that's where we see clashes and things not working or not happening effectively.
Yeah, and it's resonated very well for the example where you reflected from your experience with your team. Now it's making sense, and it's a larger and bigger scale when it's coming for the whole country, which is fine. Now I think we stuck with the reality. We have nothing to change. We need to advocate more with the leadership and make sure the midline leadership are connected with the upper leadership across any organization, across all the country, because the decision maker in the upper level in the organization, they don't see the issue how the real people, they see it. And
Yeah.
I think here a lot of maybe communication, trust, workshop, alignment, engagement, mandatory regulatory bodies, maybe those will help.
Yeah.
I like when when I saw you are in the stage and TEDx, and you have a speech about the healthcare system and the change. And for someone is none from the clinical background but have that passion, it's make me feel very proud to have such a team working with us and try to speak up. So can you please share with me what is your aim in that time? What is drive you to go
Yeah.
go on the stage? The experience itself, it's very hard. It's not an easy. So you make all those challenges and you cross all the line and you speak up. Can you tell me
Yeah.
more?
Yeah, that one. So like I said, I think, so I also teach part-time at the university for students who who are doing their master's in health administration. It's because it's a program I've done. And as you mentioned, leadership is such an important part in driving positive change. And I'll get to your answer in a moment, but maybe one of the things I believe about relationship is that it's not about one individual. So if you look at the word leadership and you think about the word relationship, I think leadership is more about creating better relationships between people so that they work together. And I think we've idolized this role of the leader, of the heroic leader who knows what to do. And my message is always about empowering. We can all be leaders working together and knowing what is our contribution to the system. How do we create effective relationships? How do we create space where we can work together towards a common goal? And as I'm sharing my ideas or my views of how I've seen human systems work effectively, I've just had a lot of people who've told me, you need to share this way of thinking. You need to put it out there. And I've had students in the organizational behavior and healthcare course that I've done who shared with me that it is true. And the research shows it. There's these different ways of thinking, but healthcare uses a lot of the traditional leadership style a lot more. And it is changing slowly. And so when there was this call for the TEDx happening in my town, one of my friends just shared the link with me and said, you should apply. And I kind of said, well, why not? Let me try. And I pitched the idea. And I think the people who were selecting topics were all part of the health system. It's not like there's a health system out there and that us as citizens are observers of it. And, oh yeah, there's these experts or doctors and nurses and they can all figure it out. So I think the way I pitched my idea, which was about how do we restore the system in our health system, they thought this would be a relevant topic for everybody because the people who go see a TEDx, they're not just healthcare people, it's everybody in the public. And so I wrote and I prepared my talk about the issues we have in our health system for the general public. Because I often find people in Canada previously used to say, we have the best system in the world, free healthcare, it works well. But I think over the years, more and more people are saying, wait a minute, our system might not be that great. And there's a lot of hole and there's a lot of gaps. And like you, there's students who come into the master's course that I provide and they come from other countries and they share with us, well, the country I come from, like this is working a lot better than here. And so people are starting to realize, wait a minute, our health system, it might not be the best it could be and we need to work at improving it. And part of my talk and part of the message is I wanted to encourage everybody to speak up about their experiences, about their stories, about being part to advocate for the change we need in the health system. Because when they do that, then politicians start paying attention to what the public wants and changing those things. So if people keep complaining about the emergency departments that are full and they can't get in the emergency department and they wait for 12 hours, well, that's where the politicians are going to focus. But if you go, wait a minute, why are the emergency departments full? Well, there's a gap in primary care. We don't invest enough in preventative care. So slowly people escalate to the most expensive part of the system, which is the hospital and emergency care in those departments. And the system doesn't invest enough in primary or preventative care, which is creating this kind of almost vicious loop of spending a lot of money on the part that's the most expensive. And I'm not saying this at all to diminish the role of the hospitals. They have a really important role, but our system is burdening them in shifting all the things there. But what also saddens me the most is hearing all these primary doctors who are burning out, who are leaving their practice. And it even recently happened to me. My family doctor announced that she wanted to reduce her practice. And I was offered an option to get a family doctor outside of town, 45 minutes if there's no traffic. And so now that's really going to change how I use my family doctor. I'm probably going to wait and think things are really bad because a 45-minute drive one way almost means half a day of my time to go see my family doctor. So this is why I'm really passionate about it, because I don't think that a problem in a system can just be solved by people in the system. You need people who are outside of the system looking at it and helping the system see itself in a different way, helping to raise those questions, raise those issues. And maybe, although I'm not clinical, I'm very involved in the health system now. I've been in it for almost 14 years. And I was on a board of a community health center. And they had this amazing assertive community treatment program that demonstrated significant savings in the clients they were serving were not using the emergency departments or the hospitals as much. But even then, they were struggling to be able to get more money to sustain this program. And at one point, they were debating, like, should we just close the program? We don't even have enough money to sustain it. And I'm there as a taxpayer going, but this program saves money to the system and we can't find money to sustain it? Like, those kind of things that I keep exposing to, it's just crazy. And so that's why I am thinking that we need more people involved. And most people realize the system is broken when they need it. But when you need it, you don't always have the energy to start advocating and asking for what you want. And I think that's why we see a lot of patient advocates. Often they are patients who've gone through the system, who've had those experiences, and then hopefully when they're well enough, they can start advocating. But there are many people who are stuck in that system, or their caregivers are stuck in supporting them in this broken system. And they might not have time to share their experiences or those stories or get what they need. So I think it is about sharing with everybody. You have a role to play in improving this system. So that's, I think, why I'm passionate about it.
If this episode sparked something in you, here's how you can keep our mission alive. subscribe to Uncharted Narratives Surdiyat. Leave us a 5-star review. It helps more amazing people discover our stories. Share an episode that moved you with a colleague or friend. Connect with me on LinkedIn and join our healthcare innovation community. Together, we're not just telling stories. Until next time, stay curious, stay passionate, and keep pushing the boundaries of what's possible in healthcare. See you in the next episode of Uncharted Narratives Surdiyat. We've covered some incredible ground today, but our conversation is far from over. In our next episode, we'll dive deeper and explore even more fascinating insights. Stay tuned for part 2 of our conversation on Uncharted Narratives.